Lupus nephritis. Lupus nephritis मीन्स यहाँ पे नेफ्रॉन्स इन्वॉल्व है और ये एक इम्यूनो कॉम्प्लेक्स डिपोजिशन डिसीज है ऑटोइम्यून. इट्स एक्चुअली SLE सिस्टमिक ल्यूपस एरिथेमेटस, इसी की ही एक मैनिफेस्टेशन है, इसी का ये पार्ट है. इसमें क्या हो गया है, किडनी इन्वॉल्व हो गई है, तो यहाँ से हमने वर्ड लिया है सिस्टमिक, मतलब बहुत सारे ऑर्गन्स इन्वॉल्व होना बॉडी के, सिस्टमिक सिस्टम इन्वॉल्व हो गया. ल्यूपस इरिथमा, रेडनेस आती है इसमें, इरिथमेटस, तो वी यूज दिस ल्यूपस वर्ड एंड ल्यूपस अफेक्ट द किडनी, सो इज ल्यूपस नेफ्राइटिस. So it's a severe manifestation of systemic lupus erythematosus and it's autoimmune disease, so there is involvement of a immunocomplex. And where the immunocomplex is deposit, it can deposit anywhere. It can be glomeruli, tubules and interstitium of the kidney. It's all part of a kidney. It can be glomerulus, tubules or interstitium, only three parts. And what happens if the immunocomplex is deposition? Obviously it start inflammation and kidney dysfunction. So immunocomplex deposit in kidney, then start their inflammation and kidney dysfunction. Now it's divided into stages, classes. Okay, so first is minimal mesangial lupus nephritis. Okay, so it's actually mimic the kidney diseases which we already studied in kidney. So but it occurred due to lupus erythematosus disease, that's why we repeat the lupus nephritis. Minimum mesangial, so it's normal appearance on light microscopy, but on electron microscopy we can see immunodeposition, and it's minimal disease, so that's why it's asymptomatic or minimal proteinuria. It's a normal appearance on light microscopy. Now next is class 2, which is mesangial proliferative lupus nephritis. In this case the mesangium undergo proliferation, that's why we call it a mesangial proliferative. Proliferation means cell undergo division. It means proliferation. So cell undergo division, the more cells are present, hypercellularity and immunocomplex deposition. So endomesangium undergo proliferation, cell division, that's why mesangial proliferative. So it's also mild, second class, so symptoms little more severe occurring, so mild proteinuria or hematuria. Now class third is a focal, means small part is affected, so focal lupus nephritis. Diffuse means large part affected. Focal, segmental or global, less than 50% of glomeruli. What is glomerulus? The Bowman capsule present there, Bowman capsule, and there's different and afferent arterioles. So it's a glomerulus, and from there tubules start. Okay, so it has epithelium. Okay, so segmental or global means a small part of a glomerulus affected or small segment affected of a kidney tubule. Segment means small part like that, it's a segment. So it's called a focal lupus nephritis. So it started their hematuria and proteinuria because epithelium starting disturbed. So hematuria, proteinuria, and mild insufficiency. Diffuse means more involvement. So it present in more than 50% of globally, most severe. So they start a severe proteinuria and hematuria as well as hypertension and renal dysfunction. Okay, so there is a focal, it diffuse. Focal small part, diffuse large part involved there. Less than 50% focal, more than 50% it's globally is diffuse. Now membranous. Membranous has a subepithelial immunocomplex deposition and thick capillary walls. So it's generally cause nephrotic syndrome, but renal function initially preserved because membrane only affect. So in membrane, below epithelium and below epithelium immunocomplex deposit, due to which the capillary wall, because epithelium is a capillary nerve, so it becomes thick, wall thick. Okay, it's a capillary as epithelium, below which immunocomplex deposit and it becomes thick wall. So it's a nephrotic syndrome, which is proteinuria. Okay. Now in advance, more than 90% glomeruli are involved and it causes irreversible renal failure. Now goes to symptoms. What's a symptom? We think obviously SLE symptoms. SLE symptoms क्या क्या होते हैं? Weight loss, fatigue, fever और arthralgia, because joints are also involved, immunocomplex deposit on joint. ठीक है. In SLE, joint pain, weight loss, fever, fatigue. Kidney also involved, that's why renal specific symptom, hematuria, proteinuria and edema because of loss of protein, albumin loss and salt retention, it causes edema. And hypertension. Sign, hypertension severe causes में peripheral edema because of nephrotic syndrome where protein are lost. And uremic symptoms, kidney not function properly तो urea accumulate in blood and it goes to brain, it's nausea, vomiting, altered mental status. Diagnostic criteria, at least more than 4 fulfilling the ACI और SLICC criteria. ठीक है. Systemic lupus, clinical and etiological, like renal criteria के लिए we have a proteinuria इतना होना चाहिए more than 0.5 gram per day or greater than 3+ on dipstick, and cellular cast in urine. Cellular cast can be red cell, hemoglobin, anything. Renal biopsy is gold standard. What's investigation? Laboratory test, urine analysis, proteinuria, hematuria, cellular cast, protein creatinine ratio, serum creatinine and GFR. Autoimmune panel, antibodies check. In SLE, anti-nuclear antibody we check, anti-double stranded DNA antibody check, and low complement levels. And with the help of renal biopsy, we can determine which class of lupus nephritis is present and according to which we treat them. It's guided therapy. What's a management? Obviously fluid management because edema occur ना. And salt restriction, hypertension कंट्रोल करने के लिए ACE inhibitor, angiotensin receptor blocker, immunosuppression because autoimmune disease there, so the corticosteroids, methylprednisolone, cambipridine, immunosuppressant, cyclophosphamide, mycophenol or mofetil if their woman is childbearing. Okay. In childbearing women, we use mycophenol and mofetil. So it's an induction, which is an immunosuppressive therapy. Now maintenance therapy, lower dose of mycophenolate and tapering corticosteroid means stop the steroid slowly. It's tapering, lower the dose and then stop. And then doses of immunosuppressants also decreases and then maintain at a level, like initially it's a 15, let यदि 15 था शुरू में तो बाद में हम कितने ले जाएंगे उसे 3-4 थे और उसके बाद सिर्फ इतने ही कंटिन्यू करेंगे, मीन्स हमने डोज को कम कर दिया. इन मेंटेनेंस थेरेपी, टारगेटेड थेरेपी इन द केस अगर इनिशियल कोई हमें आराम नहीं मिल रहा, रिफ्रैक्टरी केस, रिलैप्सिंग केस, पहले वाले ट्रीटमेंट से कोई रिस्पॉन्स नहीं आया, रितुजिमाब एंड बेलीमुबाब. सपोर्टिव थेरेपी टू कंट्रोल हाइपरटेंशन, एंटी हाइपरटेंसिव एंड anticoagulation if there is a risk of a thrombus formation, and statin to control the dyslipidemia. And if the kidney is completely damaged end stage, then only dialysis and renal transplantation is option. But we have to first control the lupus because affect the other organs also, no? And it's autoimmune. So active lupus must be controlled first, because if not control the lupus and kidney transplant, then again kidney can damage. So must first control the active lupus.